Dear students, myself Dr. Hitesh Shah, Assistant Professor in Community Medicine Department, Government Medical College, Surat, Gujarat. I am thankful to IAPSM eConnect to provide me the opportunity to connect with the students and to discuss the basics and classification of adverse events following immunization. At the end of the session, students should be able to define AEFI, understand about the basics of the AEFI, know the cause-specific classification of the AEFI, able to differentiate between minor, severe, and serious AEFI, understand about the clusters of AEFI, and sensitize about the management of the AEFI in brief. What is AEFI? The acronym is AEFI. The full form is A for adverse, E for events. I am specifically once again making a point that E is for events, not for the effects, as majority of the students are doing this mistake during their theory as well as practical examinations. F for following, I for immunization. So an AEFI means any untoward medical occurrence which follows immunization and which does not necessarily have a causal relationship with the usage of the vaccine. The adverse event may be an unfavorable or unintended sign, abnormal laboratory finding, symptom, or disease. Why to learn about AEFI? Management and causality assessment of the AEFIs are the integral part of the Universal Immunization Program, that is UIP. UIP intended for the wide coverage, and in last few years, as you all are aware, under the UIP, newer vaccines are introduced. When the newer vaccines are introduced under the UIP, a vigilant eye has to be kept on AEFIs associated with the newer vaccines, and along with that, AEFIs or reports or rumors about the AEFI has detrimental effect on the implementation of the UIP. Thus, the prompt reporting, scientific management, and causality assessment of the AEFIs are essential for effective implementation of the UIP. Now, cause-specific classification of the AEFIs. As you all are aware that vaccine contains or ingredients of vaccines are antigen, either in the killed form, live attenuated form, or toxoid, etc. Preservatives, adjuvants, stabilizers, and antibiotics. And when the vaccine is made up of these ingredients, sometimes due to these inherent properties of the vaccine products, an adverse events may happen, and that kind of the adverse events are classified as vaccine product related reactions because it is an inherent property of a vaccine product. While making the vaccines or while producing the vaccines, a quality control check should be done. Then also, if at all there is a quality defect in the vaccine product or including its administration device, and if any AEFI happens, then it is vaccine quality defect related reaction. Immunization is basically a process where the storage, transportation, and administration of the vaccine to the beneficiary are the parts of that particular process. An AEFI that is caused by inappropriate vaccine handling, prescribing, or administration that are labeled as immunization error related reactions. The immunization process itself can create anxiety among the beneficiaries or the recipients, and if at all any adverse events related to the anxiety, then it is known as immunization anxiety related reactions. Sometimes adverse events may happen, but that is not related to the vaccine product or immunization error or immunization anxiety, but due to some other cause, then this immunization related cause. Then it is known as coincidental events. These are the few examples of the different categories or different classifications. Say for example, extensive limb swelling following penta or DTP vaccine is an example of vaccine product related reaction. Failure by the manufacturer to completely inactivate the agent is an example of vaccine quality defect related reaction. Transmission of infection by contaminated multi-dose vial is an immunization error related reaction. Vasovagal syncope in an adolescent is an immunization anxiety related reaction, and a fever due to malaria but followed by immunization is an example of the coincidental event. Now let us discuss the vaccine reactions in terms of the severity. So vaccine reactions are of three types in terms of the severities: minor reactions, severe reactions, and serious reactions. So first let us discuss about the minor reactions. Minor reactions usually occur within a few hours of the injection, and generally it resolves after the short period of the time, and it poses little danger. But do not forget that it is a matter of worry for the mothers and the caretakers. And minor reactions are of local and systemic type. Local minor reactions are pain, swelling, redness. Systemic are fever, irritability, and malaise. This table shows the documented prevalence of the local as well as systemic minor reactions associated with the different vaccines. Now let us take the example of the BCG. So it has almost all the BCG recipient has the local reaction in terms of pain, swelling, and the redness, but there no systemic reaction or is documented for the BCG vaccine. In contrast to that, in case of pertussis, almost 50% of the beneficiaries or recipients have the local reaction along with the systemic reaction in terms of the fever as well as irritability, malaise, and systemic symptoms. Now, let us discuss about the severe reactions. Severe reactions are usually do not result in long-term problems, can be disabling, but rarely life-threatening. It can include the seizures as well as the allergic reactions. What is the difference between serious and severe reactions? So, severe reactions can be disabling, rarely life-threatening. Most do not lead to long-term problems. Examples of the severe reactions include non-hospitalized cases of the anaphylaxis that has recovered, high fever, hypotonic, hyporesponsive episodes, etc. But in case of serious reactions, the serious reactions are or can be results in death, requires inpatient hospitalization, results in persistence or significant disability as well as the clusters of the AEFI. And both the severe and serious reactions need to be reported and investigated thoroughly. These are the examples of the severe reactions associated with the vaccines along with it at its onset interval and frequency per dose. So say for example, in case of the OPV, vaccine associated paralytic polio, that is VAPP, and the onset interval is 4 to 30 days and frequency per dose given is 2 to 4 per 10 lakh doses given. And same in case of the DTP vaccine, prolonged crying and the seizures can be started in 0 to 24 hours, that is within the 1 day, and frequency is less than 1 per 100 doses. So different kind of the severe reactions are associated with the different vaccines. Let us talk about the anaphylaxis as an AEFI as it is important to learn about the anaphylaxis. It is a life-threatening allergic AEFI. Risk of anaphylaxis for following vaccination is very rare. So it's a very rare AEFI, but it's a life-threatening AEFI. The onset is rapid, means within the few minutes and up to the 1 hour following immunization. And a case of anaphylaxis is suspected when sudden onset as well as rapid progression and two of the three systems related symptoms are there, and their three systems are respiratory, cardiovascular, and dermatological or mucosal systems. So two of the three systems are involved, and sudden and rapid progression can give us the idea about the anaphylaxis. These are the examples of the signs and symptoms of the different systems involved in the anaphylaxis. They are respiratory system, cardiovascular system, as well as dermatological system. Immediate management of the anaphylaxis includes reassurance of the patient, parent, or relative, immediate administration of single and age-appropriate dose of the injection adrenaline by deep intramuscular route or anterolateral aspect of the thigh, immediate referral to the nearest referral point, that is PHC, CHC, district hospital. Do not leave the patient alone and take care of the patient's position. So this is the immediate management of the anaphylaxis at the field level. Now let us discuss about the immunization error related reactions. What are the potential causes of the immunization error? So they are non-sterile injections, reconstitution error, injection at incorrect site, vaccine transported or stored incorrectly, as well as the contraindication ignored. Now, basically, immunization error can happen in these three stages. One is error in vaccine handling, like exposure to heat or cold, or using the product after the expiry date, and these are the related reactions like failure, loss of potency of the vaccine. Second error happens while prescribing the vaccine or non-adherence to the recommendation for the use. So one of them is failure to adhere to the contraindication, and that can lead to the anaphylaxis or disseminated infection. Failure to adhere to the vaccine indications or prescriptions, systemic or local reactions, neurological can happen. And third one is error in administration, use of incorrect diluent or injection, so that will uh, cause the reactions. Incorrect sterile technique or inappropriate procedure with a multi-dose vial, that can lead to the infection at the local as well as the systemic also. So in case of immunization error, there are three stages. One is error in the vaccine handling, error in vaccine prescribing or non-adherence to the recommendation for use, and error in administration of the vaccine. Now, immunization anxiety related reactions. Mainly, they are the three reactions. Fainting, that can affect older children and adults, and it doesn't require any management beyond the giving the injection while the patients are seated and placing the patient in a recumbent position after the injection to avoid the injury caused by falling. Hyperventilation can cause lightheadedness, dizziness, tingling around the mouth and in the hands. Vomiting is common in younger children, and breath holding spells may occur, and but it can lead to the brief period of the unconscious, after that, during which the breathing resumes. Coincidental AEFIs, as we discussed earlier, also means not related to vaccination process, but event happened following immunization. That means temporal association is there, but not the causal association. Sometimes these coincidental events are creating the panics in the community, and that is why the rapid investigation and follow-up and management of the AEFIs or coincidental AEFIs is essential. Now we learned about the cause-specific classification of the AEFIs. Now we are moving ahead with the clusters of the AEFI. So clusters of AEFI events means two or more cases of the same adverse event related in time, place, or vaccine administered. So two or more cases of same adverse event, they are either related to time, place, or vaccine administered. Clusters can be usually associated within a particular provider or health facility or a vial of vaccine that has been either inappropriately prepared, contaminated, or inappropriately used. Now, this is the algorithm of the to classify the clusters of the AEFI. In brief, this algorithm directs us to classify the cluster of the AEFI according to the cause-specific classification. Let us take the example. Say, for example, one cluster of the AEFI is reported in all cases from only one facility. If it is yes, then most probably it is an immunization error. But if it is no, then we need to check that all cases get same vaccine or same lot of the vaccine. If yes, then second question should be similar illness in others who did not get the vaccine. Means those who do not get who did not get the vaccine, they also have shown the same adverse effects. Then adverse events, then they are definitely coincidental events. But if no adverse events in the children who did not receive the vaccine, then most probably it is an immunization error, transport or storage error, or vaccine quality defect reaction, as all cases got the same vaccine. If it is no, then known vaccine reaction. Is this reaction is the known vaccine reaction, means is it an inherent property of the vaccine, and rate of the reaction within the expected rate as I have shown in the table, then it is a vaccine product related reaction. So the cluster is of vaccine product related reaction. If no, if the rate is not within the expected rate, then most probably it is an immunization error or vaccine quality defect reaction cluster. If it is not a known vaccine reaction, then similar illness in others who did not get the vaccine. If it is yes, then the same coincidental event. If it is no, then most probably it is an immunization error, coincidental or unknown. So this algorithm can classify the cluster based on the cause specific classification. Now, management of the AEFI in brief. So during the vaccination sessions, 4 key messages of the UIP, which includes the message related to the minor adverse event, should be delivered to all the beneficiaries. Waiting of the all recipients of the vaccine at least for 30 minutes post vaccination should be done to rule out the anaphylaxis. Reassurance and management for the minor vaccine reactions is the key management for the minor reactions. Availability of the functional kit at all vaccination sites, as well as training of the healthcare workers about the use of the AEFI kit as and when required. Immediate referral of serious and severe AEFIs, reporting of the AEFI to the health system, and causality assessment of the AEFIs. These are the few of the management points regarding the AEFI. These are the contents of the AEFI treatment kit, and this should be available in functional condition to all the vaccine sites. Resource material, or for the further reading, I suggest that AEFI Surveillance and Response Operational Guidelines 2015 should be referred. Now students, the possible questions can be asked from this particular topic in theory as well as in the practical exams are AEFI definition, AEFI classification with examples, definition of the clusters of AEFI, immunization error related AEFIs with examples, common minor AEFI following specific vaccines, management of the AEFIs, AEFI kit content. So these are the commonly asked questions from this particular topic. I am highly indebted to the IAPSM eConnect team as well as specifically the UG Connect team for providing me this opportunity. Thank you.